musculoskeletal system exists to provide support to our body, protection to many of our vital organs, such as the brain and the lungs and others, and to provide movement so that we can respond to our environment. The skeleton is a collection of bones that make up the frame on which we exist. These bones, of course, enable us to have movement, because if we didn't have a bone, then the type of movement we would have would be uncoordinated. Bones also exist for a number of other reasons, such as a storage place for calcium and other minerals, to provide blood so that we can make blood. When we look at bones, there are 5 types of bones. And so as you visualize and look at the names of the bones, see if you can fit them into the 5 categories. There are either long bones, such as the bones of our legs and arms, short bones, the tiny little bones found in our wrists or ankles, flat bones, such as our shoulder blades, could be our skull, could be our pelvis, irregular bones, which are found in our vertebrae, and a single sesamoid bone, the kneecap. So 5 types of bones.
Here is the anterior or frontal view of the muscular system. And here is the posterior view of the muscular system.
Pathology. Pathology will either involve the joints, the bones, or the muscles. And so, as you read through the pathology of the system, see if you can identify which of these the pathology name is making reference to. When we look at carpal tunnel syndrome, for example, we're looking at a ligament and a tendon basically being irritated. So it involves more than one thing. And you may ask, what is a tendon? The tendon attaches the muscle to the bone, while a ligament attaches a bone to a bone. In gouty arthritis, we see basically an inflammation of a joint, but primarily because of the buildup of uric acid, which crystallizes in the joint, making it very, very difficult to move that joint.
Muscular dystrophy is an inherited condition that causes progressive weakness and degeneration of muscle fibers. Osteoporosis refers to a decrease in bone density, which thins and weakens bone structure, while rheumatoid arthritis is chronic inflammation of the joints, causing pain and swelling. Lastly, rhabdomyolysis is the breakdown of damaged skeletal muscles.
When we go to lab tests, what do we see? Is we're measuring certain blood components to look for various things that may be deficient in the blood supply. So do read through the various lab tests and see if you can identify what is being measured by that particular lab test. In the diagnostic procedures, we're using various things to make a diagnosis. So we may do the most common, the X-ray imaging. It could be of a joint or of a bone. We may look visually at a joint. We may look at bone density, or we may do other kind of tests. And of course, as usual, look at the abbreviations included within that.
Which of the following tests are non-invasive? Is it A, arthroscopy, B, arthrocentesis, C, arthrography, or D, muscle biopsy? The correct answer is C, an arthrography.